to start with. So today's guest speaker is Dr. Athiresh. A very warm welcome to you, Doctor.
Hello, good afternoon.
Yes. So to introduce Dr. Athiresh has done his MBBS from JJMC College. Doctor has also worked in NHS UK, and Doctor got selected for the IMT training. So today, as we all know, we'll be speaking about the CREST Form. So Doctor will tell you what is CREST Form, who should sign CREST Form, and all the other further questions what you have, you can ask Doctor at the end of the session. Questions will be addressed at the end of the session. So even if in the between, if you have any confusion in any of the topic, you can put that question in the Q&A section. Also, we will be sharing a feedback form at the end of the webinar. Please do give your valuable feedback to us. Doctor, you can take over the session from here.
Hello everyone, I'm Dr. Athiresh K. Narayanamurthy. I'm presently working in UK NHS in trauma and orthopedics. This was my first job after clearing my PLAB exam, and I used this job very wisely to do some of the competencies and get my CREST form signed and get into training. Today, I'll be discussing mainly about what is CREST form, what you need your competencies to get your CREST form signed, who can sign your CREST form, and why you need your CREST form. All right. So CREST form, CREST stands for Certificate of Readiness to Enter Specialty Training. So the latest available form is from 2021. So you can continue to use the CREST form of 2021 for all your further training until and unless there's a new version of form which has been released by Health Education England. So you need this form to enter into specialty training, that is ST1 training in any department. This is mainly required for the international medical doctors who are not trained in UK, who has written their PLAB exam and come to UK doing some jobs in the UK and need to enter into specialty training, let it be surgical or medical, psychiatry or GP, anything in that matter, they need to get this CREST form signed. So this form can be signed by a consultant or equivalent. So it means a general practitioner or medical director of your hospital or any academic advisor or medical college professor who is qualified enough and is equivalent to the role of consultant. If it is a UK consultant, even if he is a local consultant, it is fine. He can sign your CREST form. If he has the CCT, that means completion of co-training, and also he's on the specialist registrar in the UK. If you're getting it signed from a doctor, a specialist doctor who is not in UK or who is not registered to UK, for example, a specialist in India, you can get it signed as long as is ready to share his registration with his state body. For example, if he's registered with MCA or if he's registered with Karnataka Medical Council or Kerala Medical Council, he has to share the registration details, and he has to take the responsibility in case the Health Education England or GMC contacts him to ask a few queries regarding your competency. He should be ready to answer. If not, it will be reported to his registration body. So you need to work under a consultant or specialist for at least 3 months continuous period for him to be eligible to sign your CREST form. And this CREST form should be signed within 3.5 years prior to the date you'll start your training. Most of the training in UK starts in August. So you can keep a timeline with 3.5 years before that your CREST form should be signed during this period. And you should have worked for at least 3 months under that consultant. And second thing, I know it's very difficult to have all your competencies within the 3 months period. So the guideline says, if your consultant is happy and he believes and he has proper evidence that some of your competencies were done previously when he was not observing you or monitoring you or you were not working with him, but the evidence he received is trustworthy, and if he is confident with that evidence, he is able to sign all the CREST form, provided you have attained those competencies within the last 3.5 years before starting your training job. And most important thing is the consultant or specialist signing the CREST form should not be related to you personally. It should not be your spouse, your parent, or your relative, or as a close friend whom you know outside of your medical profession. GMC is little strict when it comes to nepotism and other things, so they take these extreme measures. And for doctors who are currently on foundation training in the UK, they need not sign this CREST form. Instead, they have another form to be signed. It is called UK FPO. You can look into details of this form in the Oriel website. They need to get this form signed by the deanery or the training director of that particular institute. If any doctor who has joined the foundation program and has left the foundation program in between for various reasons, it's no matter what, they cannot get the CREST form signed. Instead, they have to get another form. It's like a clearance form from the deanery. You can find the form and the details of that on the Oriel website. So your CREST form will be valid if every section of the CREST form is signed. If something is missing, your CREST form is invalid. The consultant signing has to sign all his details, his registration number, his email. Usually in UK, everyone prefers the work email rather than Gmail or a Hotmail, and his phone number and his present workplace where he's working and the details. And you also need your hospital stamp. I'll explain about it in a while momentarily when I go through the form. All right. And after you're getting your CREST form signed, it's very important that all the pages of the CREST form is scanned into one single document and it is uploaded. You cannot split it into multiple documents. That will be invalid. This form consists of 11 pages, and the 11th page is optional. I will get into it in detail. So this is the first page of the form. As you can see, you need to fill your details. You need to be registered with the GMC to get your CREST form signed. Sometimes you can also get your CREST form signed with provisional registration with the GMC if you have not completed your Lab 2 completely. So your full name as it appears on the GMC website, or your passport or any legal document ID, then applicant's GMC number, then your job title. What are you? Are you a junior doctor? Are you SHO? Are you trust grade doctor? Are you CT level doctor? Are you F2 doctor? F2 level, or is it a clinical fellow? Anything for that matter. You need to mention your job role, your employer name. This can be your hospital name. If you're working in UK, this can be the trust of the hospital also. For example, Northern Lincolnshire and Poole NHS Trust, or King's Hospital Trust, or anything. Then post start date and end date. This post start and end date, you can mention like your complete job or during the period in which the consultant has observed you. Either of things can be filled, but this thing is very important, as if the dates do not coincide, you're going to end up in you're going to be in trouble, and your certificate is going to be invalid. So please make sure all your dates are proper. And next, there are a few declarations you need to declare. That you have attained all the competencies with, during the period where you continuously work with the consultant for 3 months is a continuous period, and all of these competencies are attained 3.5 years before the training job start. This is very important because sometimes there are many specialist doctors from various countries who apply for junior level training in UK. So you might think when you're a specialist, why do you need this CREST form? The reason UK has adopted this system is, even though you're a specialist in your department, when you start a training, you're working at basic level, at the level of specialty training 1. So as a junior doctor, you need to be skilled and trained in various broad specialties. For example, like from basic IV cannulas, blood sampling, and other things, which some of the specialists would have forgotten their skills due to lack of continuous practice. So this is the reason why UK has adopted the system of getting CREST form. Even for any specialist or however qualified the doctor is, he has to get this CREST form signed to enter into ST level training. and you need to confirm that you follow the good medical practice. In the good medical practice, you can find there's a beautiful booklet on the GMC website. There's a good section regarding prescribing for yourself, your friends or family. It's illegal to prescribe medications for yourself and your family or close friends. You have to go to the legal system. So you need to read the good medical practice and understand regarding good medical practice, not just for the CREST Form, for your everyday working in UK as well as any other country. That is a beautiful guidelines. Next, you need to confirm that you're not in any relation or you're not related with the person signing the CREST Form. You're not family or friends or someone you know outside of your workplace. And for the questions where you can download your CREST Form, there are many websites you can download your CREST Form. I would say the most legal website would be Oriel website, which is by the Health Education England. So you get the proper and most up-to-date form, so you will not be in any form of trouble later. So this is the first page, and where there's a section which starts with professional behavior and trust. In this, there are a set of questions which the consultant might ask you, or he might not ask you. He might have observed you during the work tenure. So the consultant has to tick in one of the box of the 3 columns. It might be personally witnessed. If he has witnessed the competencies, your practice, your medical practice, he can tick in personally witnessed section. If he has not witnessed some of the competencies personally, however, he has accepted your competencies through some evidence. For example, if you're working in UK, if you are working at F2 level job, you have something called e-portfolio or CREST portfolio, wherein you upload all the things you do, all your competencies. And if any other doctor, any registrar or any other consultant has witnessed you during that procedure and has signed you on the portfolio, or you have your logbooks which mention about your competencies, and it is signed by another consultant, then if the consultant signing CREST Form has agreed to accept that evidence, then he can tick in evidence received. If the consultant he cannot confirm the evidence, or he cannot confirm your competency, he will tick in unable to confirm. If the consultant ticks in unable to confirm, it means that you will not be eligible for applying to specialty training. The GMC and Oriel Health Education England is very clear in that each and every competency has to be completed successfully. Even if single competency is not successful, you will not be eligible for training at that time. You need to get that competency signed, get a new CREST Form signed, and you can apply next year. First thing is professional behavior. So are you a good doctor in the sense, not just with your medical decisions, with your communication, with your body language, with your relation with your patients, relation with your colleagues, your punctuality, your honesty, everything comes into matter. And also, every institution has their local guidelines. If you follow their local guidelines, if you meet the basic requirements, they have mandatory training, like training in BLS, training in ALS, training in adult research, training in how to use the computers of that trust, or safeguarding, or anything in that matter. If your hospital requires some legal training for you to undergo to work in that hospital, and if you have attained all those competencies, then your consultant can sign or can put a tick mark in personally witnessed or evidence received based on your situation. Second thing is personal organization. Honesty and obedience is one of the things which everyone values a lot in UK. So you need to be committed to your work. Like, you need to be honest when you're attending your work, joining teaching sessions or any meetings or webinars in the hospital. You need to be in time, and you need to be very honest. If you're unable to attend something, you can let them know that you're unable to attend the session or teaching session or the meeting or trauma meeting or rounds, or if you're late for duty, whatever it matters. You need to let them know that you'll be late for so and so reason, and they do accept it, and they do agree with you. They're very polite in that manner. And every page at the end, your consultant has to sign, and then you need to mention your full name and date of completion. And in the second page, it's the same professional behavior and trust, personal responsibility. So when you're When you're treating your patient, you are solely responsible for everything for that patient, not just the physical health, even his mental health. And you need to be responsible in the sense, if you are not sure of any treatment, you need to call for help, you need to ask your colleagues. There's something called patient beneficence, where everything you do, you need to do for the benefit of the patient. And patient confidentiality, you need to, it's your responsibility to keep the patient records safely confidential. You should not post on social medias or discuss with irrelevant people, or you should not discuss with your colleagues while in your canteen, where it's a public place or it's not a safe place to discuss regarding some other patient's health records. So all these things come into place in this section. Patient-centered care. I was telling, this is one of the core values of NHS, patient-centered care and patient beneficence. Everything you do should be to benefit your patient and give 100% good care for your patient. Patient trust. You need to trust your patient. There should be a good doctor-patient trust. Otherwise, the patients will not open up with you. Patients will not talk to you or tell you more details of themselves, which can alter the treatment at some times. And consenting. There are a few procedures which UK F2 levels they need to get their competency signed, like basic IV cannulas, performing ECG catheterization, interpreting ECG, interpreting blood results, arterial blood gas sampling, venous blood gas. And there are a set of few basic skills. You can go through them through the link provided here, or you can go through them in the ORIAL website. So some of the procedures need oral consent, where you, if the consultant has seen you work and take oral consent very well, he'll be very happy to sign this off. If there are some procedures which need a written consent, like a central line or any other surgery or minor procedure the patient is undergoing. If you are not eligible to get the consent, if you have done the consent when there's a consultant supervising you, at that time also he is ready to put the tick box, and so you can say you're obtained this competency. Next, ethical and legal requirements. So you need to be very ethical. You need to follow the general GMC rules very well, and it means not looking into patient records unnecessarily, not looking into your colleagues' records. And ethics in UK for a doctor means not just your profession, outside your profession also. For example, if you have legal issues in this country with the police or with any law, it might be some illegal driving or breaching some travel restrictions, or traveling without ticket, or anything in that matter. GMC takes it very seriously. You need to be ethical as a true in your profession as well as your personal life to be a good doctor. Next, mental capacity. You should know how to assess the mental capacity of the patient, because you cannot take the patient decision if they're not mentally competent to retain the information and process and answer and communicate about their decisions, whether yes or no, if they're happy with the decision or if they're not happy with the management, if they're not understanding what treatment they're undergoing. So you need to know if your patient is mentally competent. So in order to know more about this, you can read about Mental Capacity Act on the GMC website. You will get a clear picture. For those doctors who are still not started the PLAB journey, you can get these questions on the PLAB 1 and PLAB 2. So you need to read regarding Mental Capacity Act. Next, protection of vulnerable groups. Your consultant will ask, do you know how to identify if someone is vulnerable, like safeguarding children, safeguarding adult, abuse to adult, domestic abuse, domestic violence, or if any child is abused. You need to keep an eye of non-accidental injuries and know how to treat them. Involves your seniors, involve the safeguarding team, involve various specialties, do necessary investigations. So you need to know the principles of treating vulnerable groups. So if you know this, sometimes the consultant might expect you to have dealt in one of these patients. Otherwise, he might ask you questions before signing it. What knowledge do you have regarding safeguarding issues or vulnerable groups? So you should be ready to answer. And next, self-directed learning. So you need to